Well, hello there. This is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. I'm out for my morning walk this morning, and this particular video is going to be about something called aphasia and modeling and mirroring. Now, you might say, modeling and mirroring, what do you mean? Well, what I mean is that a lot of times when people want to learn something, they have to emulate a person or a method that already works, okay? So if you want to learn how to do something, you find somebody who knows how to do it, and then you ask them if you can spend some time with them, and you watch them do whatever it is that they do, whether they're playing golf or whether they're bowling or playing tennis or helping someone talk better. You watch them. And then as you watch them, you model them. You do what they do. And that's not all that difficult. I mean, that's how I learned how to tie my shoes. I mean, that's how you learn how to do things. You find somebody who already knows how to do it. You hang out with them. You watch what they do. You listen to what they say. You find out how they do it. And then you start doing it. I mean, you know, that's how it's done. It's not a complex procedure. And, you know, a lot of people think, and I can't tell you how many people, how many caregivers I've worked with, who I've met with, and they say, well, I'm thinking about going back to school and being a speech pathologist so I can help my son, or I can help my husband, or I can help whoever it is. But, you know, they don't really have to do that. They just have to know what it is that their loved one has, whether it's an apraxia or whether it's aphasia. And then they've got to find somebody who's an expert in the treatment of aphasia or apraxia. Then what they want to do is they want to start spending time with that person or studying what that person is teaching. And often it's in videos or books, or you could even go to that person personally and let them know what it is that you want and have them mentor you. And what you do is you watch what they do, and then you do it. You watch what they do, then you do it. You watch what they do, then you do it. I mean, that's how most people learn how to do things. It's not rocket science. Now, but the other thing besides watching what people do and then doing it, when it comes to speech, is you watch what they do and then you listen to what they do. Because with aphasia and apraxia, you have to have what we call a speech model. In other words, you have to say the words for them initially, and then have them repeated after you. Now, there are certain things that you learn about how to sit, how far away you need to be, whether or not you're using one word or two words or three words. I mean, there's a whole sequence of things that you must know and you must do. And those things an expert knows and can walk you through exactly what you need to do with your loved one. So you allow the therapist or the speech-language pathologist to work with you and your husband, or you and your wife. And when the speech pathologist does a particular type of therapy, then you watch and listen. And then if the speech therapist is really good, he or she will make sure that you do it then. And then it goes back and forth. We show you what to do. You listen, you watch, then you do it. And then it goes back and forth, back and forth, back and forth, like a tennis game. It's not, well, you just watch me for 30 minutes and then do it at home. It's not that. Because I'll tell you, I used to sit in those observation rooms and try to watch these therapists work with patients, and within about 10 minutes, I'd fall asleep because I wasn't involved. I didn't really have a stake in the process. And so that's why I always believe that if you're going to be mentored and you're going to learn how to model and mirror, or mirror and model, then you want to be in the room. You want to be sitting right next to your loved one. You want to be sitting right next to the therapist. And you want to take turns with the therapist, having the therapist show you what to do. Okay? That's called mirroring. Then you do exactly what you saw, and then you listen to the model, the speech model, how the speech model was said, how the word was said. And then you model not only what the therapist says, but what the therapist does. So you're doing two things. You're watching what they're doing, and you're duplicating that, and you're listening to what they're saying and how they're saying it. And that's called mirroring and modeling. Now, these are two critical areas of speech therapy that if you don't learn how to model and mirror, or how to mirror and model, then you're going to be leaving that person in the dust, and they're not going to be able to do what it is that you want them to do. So if you want to find out more information about modeling and mirroring, or mirroring and modeling, you can find it in our books, teaching of talking books, whether they're for aphasia or apraxia, or you can find them on our video program if you want to model the way I work with the person in the video and then do it yourself. You can do that. Or what we can do is set up a time, and you can consider being mentored one-on-one with your loved one, where I'll walk you through every step, and I'll make sure that you can do each step as good as anybody can. Okay, so that's about mirroring and modeling. Critical aspects of speech therapy that are done with people who address the actual act of talking or speaking. Because, in a lot of therapies, they're busy writing and reading and drawing lines from words to pictures and things like that. But that's not really talking. And if you really want to talk, you want to find a therapist who's committed to helping the person with aphasia or apraxia talk. So I hope you liked the video. Mirroring, watching and doing what you see. Modeling, listening to how the therapist says a word or a sound, and doing exactly that. And as you learn how to mirror and model, you'll be able to help your loved one just like an expert. This is Mark Ittleman. I hope you have a great day. If you like this video, please give us a thumbs up. If you want to subscribe to our channel, please do so by pressing on the bell or whatever it is to subscribe. And then if you press on the title of the video, underneath the video, you'll see a bunch of links. So if you're interested in any of our books, or the online teaching of talking training for aphasia, or you'd like to speak to me, all of those links will be down below, and you can decide. So I wish for you a happy day, a happy week, happy year ahead, and may all good things come to you and your loved ones. Bye-bye now.